Hello everyone, my name is Kevin. Today is March 25th. I want to talk about the 2 meter distancing. It has been talked by a lot of politicians and health officials and also the media. But I think that's the biggest lie in this epidemic. Just use common sense. The 2 meter distance between two people is enough. Is it enough to stop the transmission of the virus? For example, if you go shopping in the grocery store, a person 2 meters away from you, if he has the virus, do you think it's safe enough for you just 2 meters away? Or if he coughs or sneezes, is it safe just 2 meters away? Obviously not. Even though you are outside and if walking like 2 meters away from others, there is always wind, right? If it's a droplet transmission, the droplets can float longer with the wind. So it's really 2 meters enough? Ask those health officials or doctors if they can stand 2 meters away from a COVID-19 positive patient without wearing a mask. They are them to do that. They will not, because they know it's not true. It's a lie about 2 meters is safe or enough. I think for everyone going outside right now, because the number of cases, everybody needs to wear a mask outside. Especially you go to indoor to buy grocery or for other activity, or if you go to for a walk, but there you can see people not very far away. You need to wear a mask. That's the urgent message I want to send out. And the other important reason is science. It's not political claims. It's science that many doctors, maybe 1 or 2 months ago in China, they already thought it was airborne. The virus is airborne. It's not only droplets. And many scientists in other countries agreed it's airborne. And finally, in March, the WHO is considering airborne precaution for the virus too. But in North America, all the officials is saying about 2 meters, which means it's only droplets and in a very perfect environment. So they are ignoring the science. If it's airborne, doesn't matter how many meters. It's indoor, it can be 20 meters, right? If it's in a elevator or in a small room, the virus can live for at least 8 hours or even maybe 2 days. So if you don't have a mask, you'll be infected. So that's two reasons. Two reasoning. If think one of the reasons, either from the science perspective or just use common sense. So we see the number of patients goes up really quickly because people think 2 meters distance is enough. They still go out without mask. They go to the superstore. You see, go to the stores. Most people are not wearing mask. So I'm really worried about the number of cases coming up. So my advice is everyone going out of your home should wear a mask. That will add 2 additional physical layers of protection, two more barriers between the two persons to stop the transmission of the virus. That's the key. People cannot just stay home for 2 months. That's unreasonable. Ask people to stay home is impossible even 2 weeks, right? If we don't go buy groceries, people will get sick from malnutrition. So I don't know why. Maybe the government cannot provide masks to the public, so they just lie. They say it's okay, 2 meters. So, and also the nurses, I'm an RN here, the nurses are very frustrated too. They don't have enough protection. And some are told you don't need to wear a mask or N95 because they're short of the supplies. They don't have the masks. So they are lying. That's the key message to the public. You have to protect yourself, your family. When you go out to buy grocery, you need to wear a mask and stay home as much as possible. Be safe.